let's have a start. So why should we care about goal setting for health and well-being, particularly in a workplace context? Well, there are many different reasons, and as yesterday was International Day of Happiness, I'd like to start with happiness as a reason. People who are able to set and achieve goals related to their health and well-being are happier. Yesterday, I was at an event in Brighton that launched a new community happiness and well-being center. There were organizations and workplaces there just like yours, offering initiatives on things related to mental health, musculoskeletal health, and lifestyle health, support on stopping smoking, and support on how to get happier and healthier employees. Now, a lot of times, employees will say things like, gosh, happiness is not something that's my workplace's business. Or employers might say something like, gosh, why should I care about the happiness of my employees? It's really about the bottom line and it's about kind of productivity. But we know, and you may know as well, that happier employees are healthier employees and they're more productive employees. There's very good evidence, including from laboratory-based studies, where researchers have brought people into the lab and asked them to think about things that made them feel happy and then looked at how quickly they performed kind of everyday routine tasks at work. And what they found is that people were much more productive when they were in a happier mood. And so something like goal setting for health and well-being can improve happiness and improve productivity on the job. Now, happiness can be defined and measured in many different ways. There's a book called Happiness by Design that I worked on back in 2014. It's about finding pleasure and purpose in everyday life. Oftentimes, when people think about happiness, they might think about just being in a good mood, but that's not always the case. Happiness can mean something much more broadly. It can mean experiences of pleasure and joy on the one hand, so something that might be quite fun, or experiences of meaningfulness, worthwhileness, this kind of eudaimonic component of well-being, on the other hand. And optimal happiness and well-being is about having kind of a balance of both. And together with colleagues, Subiona and Paul Dolan, I've worked on a project called Moments of Meaningfulness and Meaninglessness, a qualitative inquiry into affective eudaimonia at work. It's a lot of academic jargon simply to mean, how can we promote experiences of meaningfulness at work? Again, we know that employees who are happier are also more productive and healthier. So how can we promote happiness in terms of a sense of meaning and fulfillment at work too? And one of those ways is by providing context to support staff in achieving mastery of their goals. And that's exactly what I'm going to talk to you about today. So when people are able to make and achieve goals for their health and well-being, they're happier. This is assuming they set the right goals for themselves in the first place. And happiness has many benefits for workplaces. I've mentioned productivity, but there's also creativity, and happier employees spend less time off sick from work. Now, there are many approaches out there on how to set and achieve goals. Some of you might have seen them already. For example, New Year's is a time of year when many of us will make New Year's resolutions and have goals that we make for our health and well-being, lose weight, exercise more. Most people are unable to keep their New Year's resolutions. Many workplaces will have regular performance appraisals and reviews in order to encourage employees to set particular targets for themselves throughout the year, and then we'll reflect back on them. There's many approaches to goal setting out there, including something called SMART goals, goals that are specific, measurable, accurate, and timely. And many performance appraisals incorporate SMART goals into what they're doing. Does anyone use SMART goals or conduct a performance appraisals and reviews in the work that they do? If you could please drop it into the chat. I can see Diana's writing. Does anyone use goal setting with their employees at the minute? You have reviews about well-being in casework. Do you use any of the principles of SMART goals, specific, measurable, I think I said actionable, but assignable, realistic, and time-related? Anything like that? Yes, great. You use SMART. And how does that work for you, Diane?
Um, it works okay.
Could you say a bit more?
you have to kind of you have to sort of be on top of it. So I've found that the SMART goals, when you get to the time to review by which you achieve the action, as kind of everyday life gets in the way. I find that quite easily those targets, like a few of those targets, and if you don't action that straight away with the employee, it's kind of too long after the event, then you just end the process again. So I would say it's an effective tool as long as you are able to then review it at the right time. And I think a lot of things can get in the way of achieving that target. So it seems very achievable. Set it, maybe, you know, in 2 months' time, X will have happened. But then things change and staffing levels change, for example. And if you're not kind of on top of it and reviewing it all the time, I think it.
Thank you. So, I mean, certainly that's something that I experienced at the University of Birmingham. We have SMART goals in our appraisals. I said it at one point throughout the year, my priorities were changed. Things will come in the way as time goes on. John, you say you're currently using SMART for clients with health goals. Could you please say a little bit more about that? It doesn't sound like you're using it for your employees, but rather your clients.
Yeah, more for my outside of work role with helping clients improve health and well-being. I think one of the struggles I can face sometimes is actually nailing down a SMART goal that actually means something to the individual, that really is rooted into something that's going to motivate them, keep them focused. And I think the challenge a lot of the time is really getting out of that individual what really, really motivates them. I think that's one of the biggest challenges I face.
Thank you for sharing that experience. And certainly that's, feedback we've heard from workplaces before. And what we've tried to take on board with this approach to goal setting is to really encourage staff to think of something that's meaningful to them when they're setting their health and well-being goals. Thank you. So what we've based our sessions on is something called WOOP. Has anyone heard of WOOP before? You could just drop in the chat and say yes or no. So WOOP is something in the academic literature that is typically called mental contrasting plus implementation intentions. You can see why with a mouthful like that, that they've decided to call it WOOP instead. It's been around for about 10 to 20 years, and it's a science-based mental strategy that people can use to find and fulfill their wishes, set preferences, and change their habits. WOOP stands for Wish, Outcome, Obstacle, and Plan. So in these 4 steps, what staff are encouraged to do is first to think about a wish that they can set for their health and well-being, something that's really meaningful to them. And when going through the process of WOOP, it's not as simple as simply sitting down kind of for 5 minutes and quickly kind of whipping out these 4 different steps. When implementing WOOP, there's a lot of mindfulness that goes into it. So really sitting down and thinking deeply about something that matters kind of to staff for their health and well-being. I'm specifically talking about health and well-being, but I think you can see how it could quite easily be modified for different environments. The next step to WOOP is outcome. So thinking about kind of the best outcome that would be associated with fulfilling one's wish. This happens a lot in people who might like to think about what it would be like to be a certain way. So if you think about kind of exercise or healthy eating, some people will daydream about what it would be like to kind of be at their optimal weight, or eating their best food, having their ideal body type, fantasizing about what it would be like to be that perfect person, always doing their work out at the gym. In the academic literature, this is really called fantasy realization. And a lot of people will stop there. They'll think about what they want to do, and they'll think about how great it is for them to kind of achieve that wish. And about 20 years ago, researchers tested whether really thinking about and fantasizing about the future wish kind of was enough. And what they found was that it was not. Just thinking about how great it would be to achieve health and well-being goals is not enough to motivate staff and motivate people to get there in the first place. Instead, it's important to contrast that ideal future kind of with the present reality. So what is going on now that stands in the way of fulfilling that wish? What are the obstacles that get in the way? Now, you had mentioned that, especially with SMART goals, things change. So things come up and kind of get in the way. You might not review them. You might not come back to them. Employees, you also mentioned, might not pick things that are particularly meaningful to them. With WOOP, this is meant to be a very individualized strategy. So with the obstacles, we encourage staff to really focus on inner obstacles that get in the way. we can't solve everything. There are lots of things that come up in life that we have no control over. Currently, we're in the midst of a cost of living crisis, for example. That's really difficult. That's not something that many staff are able to control. And there are many things that happen in our lives that we don't have an influence on. Bereavement, family issues, moving, all sorts of things outside of work that really do have an impact on health and well-being. So we make quite clear that this is about kind of inner obstacles that get in the way. So how can staff be encouraged to think about things that might occur within themselves that get in the way of achieving their health and well-being goals? And again, it's a very mindfulness-oriented strategy. So really taking the time to stop and think, what is it within me that's holding me back? Things like motivation, negative thoughts that people might think, such as, I'm not good enough, or I can't do this. Things like, I don't have the time. How can thoughts like that be reframed in ways that can better support achieving health and well-being goals? How can staff themselves be empowered to address things like lack of motivation inside themselves? And then as a final step, an if-then plan is made. So the obstacle is put into an if and then statement. So if obstacle, such as, I'm not motivated to go on a run after work, kind of there's a plan in place. What can I do when that's the case? Well, I can go to work wearing my running shoes to make sure that I feel motivated enough after I come back from work to get outside the door right in the first place. And there are many different examples of if-then plans that staff have made. So that's WOOP very quickly, just so you have an idea of what I'm talking about kind of when I say WOOP. WOOP is a four-step kind of research-validated plan that helps people achieve their health and well-being goals. What are some examples of things that people have used WOOP for? By the way, I should say I'm happy for you to interrupt me if you have questions as I go along. I did whip through WOOP very quickly, but I know that you are all kind of managers or quite senior level in your organization, so I'm going through it more quickly than we do kind of with staff. So in terms of health, what have people used WOOP before in terms of achieving their health and well-being goals? Well, people have found that people with prejudices have become more tolerant and socially responsible. Couples strengthen their bond and decreased anxiety-related behaviors. Negotiators found more integrative and fairer solutions. People who struggled with their past overcame disappointment, regret, resentment, and other negative feelings. I think that was actually social behavior. These are the ones on health. Apologies, it was mistitled. Um, People doubled their physical activity and had a healthier diet with regards to their health. Pain patients became more physically active in their everyday lives using WOOP. People with type 2 diabetes took better care of their well-being. Depressed patients became more active and found it easier to pursue their goals. And stroke patients engaged in more physical activity and lost more weight. In studies on academic achievement using WOOP, students exerted more effort in test preparation and improved their time management. Students from underprivileged backgrounds went to class more regularly and improved their grades. Children at risk for ADHD found it easier to do their homework, and future anesthesiologists were better able to study. This is a range of different scenarios that WOOP has been effective in supporting people towards their health and well-being. So why are we doing WOOP at work? Well, there's been very little in the past on using WOOP at work before the work that we're doing right now. Previously, there were only kind of two initiatives where WOOP has been used in a workplace other than what we're doing now, and this has all been kind of healthcare workplaces. Previously, there was a study on middle managers in hospitals, and they found that people who used WOOP improved their time management, decision-making, and project mastery. There was also a study using WOOP with critical care pediatric nurses, and they found that these nurses engaged in more helping behavior when feasible when they set a WOOP to do so. So given the fact that WOOP has been so effective over the last 20 years, why aren't we using it in workplaces, especially workplaces like yours that are committed to their health and well-being journey and thrive at work? I wasn't sure about that, and neither was the National Institute for Health and Care Research. So they have provided funding for workplaces like yours to have free health and well-being sessions run by the University of Birmingham in partnership with Thrive at Work in order to kind of have these WOOP sessions with staff. They want WOOP to be something that workplaces like yours can include as part of their toolkit in order to promote staff health and well-being. That is, assuming it works. So we are conducting research to find out if it really does work. So far, we're finding out. We've done WOOP sessions with around 25 workplaces and over 300 staff in Thrive at Work. In order to develop these sessions and adapt them, we asked workplaces what they wanted. You might hear that I have an American accent, and I am from the United States. WOOP is something that's really common in the United States, so we went through a process of making sure that it was something that really would work and that workplaces here in the UK would really want. So we held initially group sessions with people from workplaces like yours to ask them if WOOP was something that they wanted and how they thought that WOOP could be most effectively provided to staff in workplaces like yours. We asked them if they wanted individual sessions. We asked them if they wanted one-on-one with researchers or Thrive at Work leads or other colleagues. And one thing they told us is that they wanted group sessions. So they wanted staff to come together and go through WOOP as a group so that they could learn from each other's experiences and discuss it. Another thing they told us is that they wanted WOOP to be something kind of specifically focused on employees and not senior level managers. They thought that employees might feel as if they had to set certain goals related to work that weren't really motivational or meaningful to them if their managers were there watching. They might say, oh, of course, my goal for my health and well-being is to hit all of my performance management targets, not I want to make sure I go on a run after work. So they asked us to have separate sessions for kind of employees and senior level managers, and that's what we've been doing. Workplaces also told us that they wanted to have the option of online or virtual sessions. We do in-person sessions, but they also told us that they wanted us to have them available online as well, with the idea that they wouldn't take up too much of the working day as well, so around 30 to 40 minutes. So we made sure that everything fit kind of into 30 to 40 minutes that could be either an online session or an in-person session. And finally, they told us to kind of take it easy on the research. They wanted to make sure that their staff wouldn't be contacted outside the sessions to do like extra surveys or follow-up or feedback forms. They wanted everything to take place in the session itself. So if we had any questions about how they were getting on with the sessions, that needed to take place in the sessions. And that's exactly what we've done. So at the moment, what we've been doing is delivering these free goal setting sessions for staff and workplaces. Going forward, we plan to continue to offer them in March, April, and May. They're 2 1-hour-ish sessions. We ask staff to set aside 1 hour in case it's a particularly talkative group, but we do find that we fit everything into 30 to 40 minutes. Our team delivers these sessions on kind of dates at workplaces choices. We will kind of rearrange what our other activities our team are involved in order to make the dates work for you. We know that you're extremely busy, so whenever it works for you to have these sessions, that's great. As I mentioned, they're online or in person. And we ask usually that sessions are around kind of 10 to 15 employees. The reason for that is that we find with larger groups, they get too big, but we can run multiple sessions per workplace. So let's say you have a really big organization, you send out the information email to staff, you say, if you want to do goal setting for your health and well-being with Laura and her team, come along to this 1-hour session in 4 weeks' time. Diane, yes, you can include volunteers. I see that in the chat. And then we would run multiple sessions. We've even done sessions run concurrently. So some people want a face-to-face session at the same time an online session is happening, and we'll bring all of our staff to make sure that we can do that at the same time. Other questions we've had in the past is, can you run these at night? Yes, we can. We visited workers who are shift workers at 11 p.m., midnight. We want to make sure that we're really kind of going out of our way to meet the needs of all of your staff members from a wide range of backgrounds and job roles. And that's my last point here. One of the things that we've been asking when we work with workplaces is if that they invite staff who are from a wide range of backgrounds and job roles. We don't just want the people who are kind of the most motivated to set and achieve their health and well-being goals. That's great, but we're also looking for people who might not have set a goal before kind of in the first place, who might not have ever thought about taking steps for their own kind of health and well-being. So please invite people who are from a range of roles, background, field, client, remote, in person, a range of ages, genders, volunteers. As I say, the only thing is if it's senior managers who are keen to be involved, if we could please run a separate session with them to make sure that they're not kind of encouraging their team to set goals that might not actually be relevant and motivated towards what they want to do. So what have workplaces been saying about WOOP so far? One of our workplaces said, this is great. We want to do a campaign around WOOP at work. We set goals for our 4 weeks. We enjoyed doing this, and now we're going to keep doing this. And we're going to encourage staff and provide an opportunity and a forum for staff to come together, even once you're done delivering the sessions, and we're going to do these ourselves. And I think that's quite nice because alongside what we deliver at the University of Birmingham, there's a WOOP app, there's a WOOP website, there's a WOOP toolkit. So even once we're done with the sessions, this is something that organizations can take on board themselves if they want to use it in the future. Something else that workplaces have said is that it's especially important for staff who aren't managers. And this is something I found myself in delivering the sessions. A lot of times managers will say to us, oh, we already know what SMART goals are, or, these 4 steps. I use things like that all the time in my work already. But what staff who aren't managers tend to say to us is, I've never set a health and well-being goal before for myself. I've been personally surprised at the number of people who have never thought about specifically setting an objective for themselves related to their health and well-being, who will say things like, is it really for me? You mean kind of not for my family? Or I just wake up in the morning and I do things as they come. I deal with problems as they come. I'm not kind of working towards something. So it's really important, I think, for people who might not have thought about health and well-being in this way before. So at the beginning of the session, I mentioned happiness. And I mentioned that one of the reasons that goal setting is important for happiness is because it helps staff kind of progress and make steps on things that are really important for themselves. Now, in the survey research that we do in order to test whether WOOP is something that works for workplaces like yours, we're asking staff about their happiness, or as it's often called, subjective well-being. And we ask them the 4 questions that are used by the Office for National Statistics to monitor national well-being. And I'm curious how happy you are as managers. So I've put up a code here on the screen to a survey called Menti. If you go to menti.com and type in that code, use the QR code, or if you don't mind, painstakingly copy in the link as well. I'll also put it in the chat. I'm curious to see how you as a group of managers are doing in terms of your subjective well-being. I'll give you a couple of minutes to do that, and then I'll show you how you compare to national averages. Okay, I can see that at least 8 of you have been able to vote, and I'm going to share my screen and hopefully show you the results. So bear with me as I bring that up. Can you all see the results now? So on average, you had about 7.5 on overall how satisfied are you with your life nowadays, which is about national average. I'll show you in a second. You had about 7.6 on overall, to what extent do you feel the things you do in your life are worthwhile? Again, that's about national average. I'll show you in a second. Overall, how happy did you feel yesterday? It's incredible, I guess, for International Day of Happiness. Perhaps your scores went up a bit because 7.9, I think, is higher usually than the national average. And how anxious did you feel yesterday? 4.3 is also quite high. Again, I'll show. So very interesting to consider and think about how you compare to national averages. The reason I showed you these particular questions is because oftentimes managers will ask us kind of, what questions are you asking our staff? It's nothing scary. We're simply asking them nationally validated questions like these in order to find out if something like goal setting is really something that is helpful and beneficial for their health and well-being. Just going to skip ahead now. Please bear with me. Great. Okay. So what do these questions look like when we are looking at national averages? As I mentioned, these are official national questions that are used in national surveys. They're included right alongside the unemployment rate. It's included in something called the labor force survey. And all of the data is kind of publicly available. If you went to the Office for National Statistics website, you could see kind of what national averages are there. And as you can see, in 2022, it looks like the national average for life satisfaction was around 7.6. You can see we're starting to recover from the COVID pandemic. There's a big dip in most of these measures kind of for COVID. Overall, to what extent do you feel the things you do in your life are worthwhile? Between 7.6 and 7.8, that's about where you were. Again, recovering after the big dip due to COVID. Overall, how happy did you feel yesterday? As I mentioned, you guys were a bit higher. I think you're around 8, whereas this graph is showing that most of the country is at an average of around 7.2, 7.4. This must be because you're part of Thrive at Work. You care about your health and well-being and happiness, much more so than the average workplace. And anxiety yesterday, not sure what's going on there, but you do have higher anxiety yesterday than on average in the general population. As you can see, it was between 3.0 and 3.2 in 2022. But again, anxiety went up due to COVID. I will say that globally, we know that from Gallup World Poll data, and this World Poll data includes pretty much these questions or ones that are very similar. For the last 10 years, there has been a worrying trend of reports of negative emotions yesterday increasing, such as anxiety and such as anger and worry. This has been going up. And so it's one of the reasons why initiatives like Thrive at Work are so important, because they provide a way to counteract this. Does anyone have questions about these particular messages? Oh, I'm seeing from John, sorry, you can only see slide 3. Are people able to see the graphs? Yes, I'm seeing some nods. And do you have questions about these measures? I mean, sometimes I show them and people say, why are you asking about happiness yesterday? It only captures Monday. But actually, on average, across all people, it balances out because people are asked on kind of Monday, Tuesday, Wednesday, Thursday, and Friday. Any other questions on these subjective well-being measures? No? Okay, so these are the kind of things we ask in the survey. Other things we ask in the survey to find out if kind of WOOP worked for workplaces like yours are, did you achieve your wish? Which I think is a pretty kind of sensible question on whether or not it worked. We also ask overall, how meaningful do the activities that you do at work feel to you? As I mentioned earlier, happiness is not just about kind of feelings of joy or contentment. It's also about whether or not what people do at work and outside work feels meaningful, worthwhile, and fulfilling. And we ask them, how enjoyable do the activities that you do at work feel to you? We want to get a real test of whether or not WOOP is something that is working for staff like yours. Because this is funded by research, there are kind of 2 different sessions. In one group, workplaces will receive 2 sessions, and the first session just does the W, and then the second session does the W and OOP. In another group, some workplaces will receive all of WOOP at first, and then they'll receive additional support in 4 weeks' time. Because there are 2 sessions, and we have 2 different groups in order to compare 2 different approaches of delivering WOOP work. So just be aware that if you do decide to have these sessions for your workplace, this could be, you could either receive the W first and the OOP kind of later, or you could get WOOP all at once. This is part of kind of broader work that's being done throughout the UK and also nationally. We previously did some research to see if providing monetary incentives to organizations like yours to help them progress through Thrive at Work helped them to do so. And what was really interesting was when workplaces like yours were given money. I'm showing a Financial Times article covering the work that we did. When they were given money, employers like you did change their behavior. They provided more information and activities and services to staff, but employees didn't change their health and well-being as a result. So even though there was more activity going on, employees themselves didn't report that they felt any healthier and happier. There were lots of reasons that this could be the case. The organizations that signed up to this tended to be kind of newer organizations. You might think that they might have been kind of more financially motivated. And there are lots of reasons that we explored for why this might be the case. But one of the reasons we're doing these WOOP sessions is we wanted to see if something could work potentially alongside money as one of the many options of things that you provide to your staff in order to support them on their well-being journey. Holly, would staff members do the survey we just did? If so, could the data be shared with us anonymously so we could look through and try to improve the figure through Thrive and other initiatives? That is a very good question. When we make the data we will make the data available, but it won't be for quite some time because academic research is really slow. So we'll publish the results of this. We're doing an academic paper. We have our protocol kind of registered online, and we'll collect all the data, we'll anonymize it, and then we'll analyze it in order to figure out if WOOP worked. But in terms of actually providing the data back to employers specifically about your workplaces, unfortunately, our ethics team asked us not to do this. However, I am happy to share the questionnaire with you after we've completed the sessions, and that way you can use those questions if you think that they're ones that would work well for you. I will mention, though, that I think Thrive at Work already does a kind of a needs assessment and a very tailored questionnaire for you. Anyone who's kind of started their journey might have been given a questionnaire that can be kind of tailored for your workplace, is my understanding, in order to find out kind of what staff need for their health and well-being. So I would suggest kind of going with that questionnaire. Staff, like many people, often get survey fatigue. All of the surveys are done kind of in the session itself, so we try not to burden kind of staff too much. If you want to kind of understand how to improve what you're doing, I would suggest using the questions that Thrive at Work have already prepared for you, because those are really more tailored kind of to broader initiatives. WOOP is just kind of one thing that can be done. What if, for example, there are needs related to, musculoskeletal health or mental health? We won't ask questions like that. Does that make sense? Is that okay, Holly, or do you have other questions? Yeah? Okay, great. So if you'd like to learn more about what we're doing, we do have a website. It's called Workplace Health and Wellbeing, a mixed methods evaluation of cross-regional workplace health and wellbeing initiatives. We're also working with other colleagues around the country who are trying to improve what's offered through kind of their version of Thrive at Work. And for example, we have colleagues in Northeast and North Cumbria looking at what the Better Health at Work Award is providing there. The Better Health at Work Award is similar to Thrive at Work, but it's in a different region. We also have colleagues in London who have been working on kind of what's being delivered in London. And they have kind of mapped out everything that's being done in terms of health and well-being initiatives around the country to think about what else could be offered as kind of a menu item on the many options that you have available to you as you support your staff on their journey. If you are interested in arranging the session, please just drop your details in the chat. You can also email me personally. My name is Laura, and my email address is in the chat there. And just a big thank you for listening. If you have any questions, I know you've been asking them as you went along. Thank you so much. I can have a conversation with you now about it, and you can also contact me after this session. So thank you very much. As I end, could I just ask, is there anyone who thinks that they might like these sessions for their staff? If you could just drop it in the chat. I'm curious to hear kind of what your thoughts are. I will say they're not for everyone. Holly, great. I will absolutely contact you. Stacy, great. Thanks. I will contact you as well. Anyone have kind of other questions too? Lucy, confirm with your manager. Completely understandable. Have a chat and see. Other questions about these or anything else? Well, in that case, I did say that when I was planning this, that I probably wouldn't take up the whole hour. I know you have very busy working and other lives, so please feel free to get on with those lives. I'll give you, I think, 24 minutes of your life back. Thank you so much for joining this webinar. I'll be in touch with those of you who said that you were interested. And in the meantime, if you have questions about this initiative or anything else, please do feel free to get in touch. Thanks so much for joining. Take care. Bye.